So good afternoon, everyone. Good morning, hello, good night, whenever you are watching this video. Today I'm doing a video interviewing a very great doctor. He's gonna introduce himself and the study he's doing. He's doing amazing work in the mental health department. His paper that we're talking about today is focusing on rural areas, rural doctors, retraining them. So we all know we need doctors, but we don't know the problems doctors are facing. We all think they're just lacking, but they are facing a lot of things that I'm sure you would want to hear. So stay in tune because you will love the video, you will love the content, and maybe even the paper at large. Go read the paper. It will be very, very interesting for you to understand more about mental health issues and all of this.
Okay, I'm Shaun Hain. I'm a doctor and I'm trying to train as a psychiatrist. So I'm currently training at the University of KwaZulu-Natal, and we did a study with Prof. Khalitsa and Dr. Milligan and Dr. Tamita on looking at the mental health of doctors in rural areas in KwaZulu-Natal. I think as we felt that rural areas are normally neglected in studies, so we wanted to look at this area. So in our study, I think we start off, we say that there's been a big push towards attracting doctors to rural areas, and there's compulsory community service. So they are getting doctors in, but then there's very little in place to retain doctors in a rural area. So it's like a tap that keeps going without it, and there's no plug. So you kind of just every year getting new people, and those new people are facing the same difficulties as before.
And eventually they leave.
And eventually they'll leave. There obviously are different reasons for leaving, and some of them are valid, some of them are not. But I think we just wanted to highlight that I think like often there's a blind eye towards rural areas or towards outlying areas, and there's a focus on the cities. And meanwhile, there's almost just less than half of the population are served by only about like 12% of the doctors that work in rural. And so there's a massive inequality there. So you've already got an inequality, and then you've got a leakage of skills that we really need to retain. And I think in our study, the most junior doctors were the most affected by burnout. And those are they're young, the age between 24, 29, and at the early stage in their careers, they're already getting burnt out. We want to retain doctors, and we saw that more than 2/3 of the doctors were burnt out, more than 1/3 of them were depressed, and just less than 1/4 of them had a significant anxiety disorder. And so this shows us there's been a big impact on the mental health, which is due to different system factors and personal factors and environmental factors. And we just wanted to really start a conversation that, listen, there's a problem, and we want equity in healthcare throughout this country, but we also need to look after the people that help the people. They're also human. So how we did the study, when we planned the study, it was pre-COVID, so our plan had to change when COVID arrived. But we were looking to access rural doctors in 3 northern districts in KwaZulu-Natal. And we got permission from the Department of Health and from each district manager and from the hospital managers. And a lot of people were keen and excited to get involved. So we used screening tools, one for depression, the PHQ-9, one for anxiety called the GAD-7, and a tool to look at burnout, to screen for burnout called the Maslack Burnout Inventory. And that's been used by many studies across the world to assess burnout in different populations. And so we looked at the human service survey for this one. And that basically looks at factors of emotional exhaustion, which is when you just feel emotionally drained by your job, but looks at depersonalization in a way that you don't really care about your patients anymore, and that you lose your humanness. And then the decreased personal accomplishment, which is whether you're satisfied doing your job or whether it's not a satisfying job to you. So we looked at those so that was for burnout, and as we said, depression, anxiety. Then we also looked at demographic factors such as what was their rank, were they community service doctors, female, male, did they want to leave the public service, the country, did they want to leave rural service. And we also looked at how far they're away from their family and different factors like that. So we were going to visit each hospital physically, but then we had to change it to an online format. And we had a 50% uptake, just short of 50% uptake of the 213 doctors that we invited. And then we analyzed the data, and that's how we came up with our results, really.
So, as someone who did the paper, what could you suggest could be done, or is that something that is going to be in some future papers that you're going to write, or is it something that you're already looking into?
I think it's easy to identify a problem.
Yes.
And so we have identified a problem in rural areas.
Yes.
And our study has just put numbers to that problem. And obviously the difficulty is now what?
At the high rate, so there is a very, very high percentage of females that are experiencing burnout. So I have read the paper for everyone. It's a very nice paper. You should read it. It's interesting. You learn a lot. I saw that it's a very huge percent. I don't quite remember well if it's 70% of them showed.
No, it's up to 85% of female doctors in rural areas reported burnout in our study.
And that's a very high amount.
That's a huge amount, and there's so many reasons for that, and I could not give it justice right now talking about it.
Yes. But
it's a big issue in itself, and we need to look at ways of supporting particularly young doctors and females, and including everyone else. But those two groups came up as very high risks, and it's a real challenge.
So
what now?
What now? Yes, to put in simple terms. What now? From here, where from here? Maybe just one thing that maybe if we could start with this, maybe it will get better. Because you cannot solve a problem in one day. I saw in the paper that there is not much research done in this area. So there still needs to be a lot of work done there before we can even get to something that resembles a solution to it.
Yeah.
So, let me just ask, I don't know if it's something that is possible for you to share that, if something that you are going to continue working on that particular subject in that particular area.
I think it's obviously difficult with in terms of funding and in terms of living in a developing country, and I think we've got to look at ways that don't require money to be thrown at the problem.
Yes.
And obviously we haven't done a study on this yet, but we believe there are certain options available, and there was a study in Georgia that looked at giving doctors different flexible hours, so they weren't forced to do a certain amount of hours. Some of them could work half days, and this allowed them to spend time with their children. It allowed them to have a balanced life and a more sustainable career. And I think that is a way in which we need to look at in the future, of not having, in terms of working hours and allowing flexibility, and perhaps you could have more doctors there, each working less hours and being happier. And we just need to look at ways like that. There's also, we're looking at, obviously outreach is is important to rural areas, and COVID has especially been a problem here. Obviously people are not moving around, and outreach was stopped. And now with technology around, I think we should be looking at more ways of outreach and supporting the junior doctors that are out there. I don't think we have an excuse for not. You don't even have to drive there. There are your ways to communicate, to assist, to help, and I think this needs to be a big drive in the future, just to support junior doctors. And we need to retain the senior doctors that are there, because they are the ones that are essentially mentoring the junior doctors, helping them. And you learn at medical school, but you learn more when you're working. And you don't just know everything all of a sudden. And for me, in my experience, those senior doctors were so influential to me, and I admired their skills and how they worked and how they stayed in those areas working. And it was incredible to me. And you actually see a proper calling of those doctors, and they're doing it for the love of their patients and for the care. And I'm not saying that you should pay them more. We don't want to throw money at the problem, but let's be flexible on how we treat each other, flexible on hours, give them a balanced life. Let's make it more sustainable, a system that's more sustainable, more than, we need to stop being too short-sighted and look a bit further, I think.